So literature actually shows that although some patients are really good at using a manual toothbrush, often patients will brush better with an electric toothbrush. And for me personally, I recommend electric toothbrush to most of my patients. So at least once a day is the answer. We'd ideally like to brush twice a day, but if you're brushing really thoroughly, then doing that once a day is okay. But ideally we'll get you to brush first thing in the morning and last thing before you go to bed. So we always recommend to patients that you should brush for at least 2 minutes. So kind of working at least 30 seconds for each quarter of your mouth. The longer the better. Yeah, so for me personally, I'd rather have my breakfast and then brush my teeth before I go before I leave the house. But every patient's different. The most important thing is that you're removing that plaque. It's just a little bit less nice to have your breakfast cereal tasting all minty. So with a manual toothbrush, you'll get you to angle the toothbrush around about 45 degrees up towards the gums and just gently massaging the gums with a light circular motion, making sure that you take the brush right up to the junction where your tooth meets the gum. And you're going to move your hand to allow the brushing to happen. With an electric toothbrush, the brush itself is moving, so you don't need to move your hand at all. And what we recommend is that you hold the brush on one tooth at a time, angled 45 degrees up towards the gum, and just gently rock and angle the brush to get into the areas in between your teeth. So this is a bit of a misconception, but in reality we don't want you to rinse out after you brush your teeth. You're going to spend 2 minutes putting this great toothpaste with lots of great ingredients onto your teeth. We want you to spit that excess toothpaste out straight after you brush, but we don't want you to rinse out with any water or any mouthwash. If you're going to use a mouthwash, the best time of day to do that is a different time of day to when you brush. So whether that's at lunchtime, after dinner, when you're getting from school or when you're getting from work, is a good time to use a mouthwash. So bleeding from your gums suggests that you might have some mild gum disease. And actually what a lot of patients find is that they see the bleeding, they get worried, and then they avoid brushing those areas. But it's actually catch-22. So we actually want you to make sure that you're thoroughly brushing and flossing and cleaning around the areas where you're getting bleeding. And what will happen over 3 or 4 weeks is that the gums will get firmer and healthier and the bleeding should reduce and then stop. If you're unsure, it's really important to book an appointment with your dentist. So there's lots of different flosses out there and it can be a little bit confusing, but for me I tend to recommend the waxed floss, which will pass easily into the gaps in between your teeth. And instead of using a traditional floss, I tend to recommend a tape slightly broader, and it's a little bit more effective at removing the plaque in between your teeth. So I tend to recommend to patients that you try and floss for at least 3 to 4 times a week. So every other day is when I want you to try and floss. So this will vary for every patient. We find for patients they're really good at having toothbrushes part of the routine. It's stuff that they've done for the whole of their life. But actually trying to build a routine around flossing can be a little bit more difficult. So I tend to recommend to patients to find a time of day when they've got a little bit more time, which for some people is not in the morning when they're rushing around trying to get out to work or trying to get out to school. It's often the last thing you do before bed. So when you're flossing, it's important to get a good length of floss from the packet, so you're not getting your fingers tied up. You're going to carefully wrap the floss around your fingers or your fingers and thumbs, depending on which part of your mouth you're trying to work in. You're going to gently slide the floss into the gap in between your teeth and take it right the way down to the gum. And you're going to pull against one side, so you're going to pull against one of the teeth, and you're going to very carefully withdraw the floss against that tooth, keeping pressure on that tooth. You're then going to wind onto the next clean bit of floss. You're going to reinsert the floss into the same space, right the way down to the gum, but this time you're going to pull to the opposite side and you very carefully slide up against that tooth as well. So if you haven't flossed before, you might find you get some bleeding from the gums, and that's mostly because Historically, those areas haven't been cleaned, the gums will be inflamed in those areas, so as you move the floss against the gums, you might find you get some bleeding. Lots of patients panic and then they avoid flossing in the future, but it's catch-22. We want you to make sure that you're keeping those areas really clean. You'll find after 3 or 4 weeks of flossing that area that the gums will get healthier, inflammation will reduce and bleeding should stop. If you're not sure, speak to your dentist. Interdental brushes are small brushes of different sizes that you use at home to clean the gaps in between your teeth. So this will vary between patients, but as a minimum, we recommend that most patients use interdental brushes 3 to 4 times a week, so every other day. So patients are really good at finding time to brush their teeth. That's part of their normal routine. What we tend to find is people find it harder to incorporate interdental brushing into their routine. So I tend to suggest to patients that they find a time of day when they're not rushing around as much. So that might not be first thing in the morning when you're trying to get to school or trying to get to work. Often that's in the evening when you've got a little bit more time, so it's the last thing you do before bed. So sizing the teeth brushes is really important. If you use a brush that is too small for the space, you'll remove some plaque, but you'll leave plaque behind. Equally, if you use a brush that's too big for the space, you've got the risk of not being able to push the brush in correctly or to traumatise the gums in that area. So you want a brush that has got to squeeze through the gap, but it's not too big to squeeze through the gap. If you're not sure which size of brush to use, have a chat to your dentist, they'll help you. So on average, interdental brushes will probably last about 2 to 3 weeks. You might find that the smaller brushes last a little bit shorter time compared to the larger, thicker brushes, but we recommend changing them once the bristles become squashed and compressed. So bleeding from your gums when you're using interdental brushes suggests that you might have a little bit of mild gum disease. And what a lot of patients do is that they will see the bleeding, panic and stop using the interdental brushes. But actually we want to make sure that you're cleaning those areas really thoroughly. So if you were to continue using the interdental brushes, those areas will become cleaner, the gums will become healthier, and most patients tend to find that the bleeding and soreness will resolve within 3 to 4 weeks. If you're not sure, have a chat to your dentist.